Okay, so we're recording.
Yeah. No, I was singing Mission Impossible.
It really wasn't our theme song.
Mission Impossible.
No, I thought you were starting to do our Nuanced naturopath theme song.
I was, but in the same way that you try and do an accent and you try and do a Scottish accent and it comes out sounding Indian. I was singing our theme song, but it was starting to sound like Mission Impossible.
So you pulled the plug.
Pulled the plug.
I thought you were just like coy about doing our themes. That's right.
I can't remember it as well as I would like to.
We'll let the theme song do its magic on its own this time. And in fact, if you're listening to this, the theme song will start to fade out now. And I'll edit it as such.
Future Corinda.
Future Corinda, as per usual, up to her antics.
Mm-hmm.
What
Hello.
is on?
Oh, sorry.
Oh, yeah, geez. Oh my God, look, it's so rude of me. I'm getting straight to the point without even welcoming anyone.
Yeah.
Hello, welcome. Thank you for clicking or tapping on us today.
Yes, thank you very much. Nice to be in your ears.
Nice to be in your ears. We are the Nuanced Naturopaths. I am Corinda.
And I am Julie.
And we talk about complicated health stuff and we try to pull apart the nuance and we try to debunk myths. And we are naturopaths and we love natural medicine and holistic health, but rarely are the answers black and white. And so here we are uncovering all the grey and leaving you no clearer than when you know.
Asking more questions than you came in.
Yes.
But I hope that some people who are listening who maybe have had some strongly held beliefs are open to some different ideas, some expanded ideas. I think that would be a good thing. And I think the discussion that we have sometimes helps to clarify a subject where there is a lot of variables and a lot of nuance.
Yep.
So hopefully
And
that's what we're doing.
Today is no exception to the rule, hey?
Absolutely. And by special request.
And by special request,
Well,
we put
by
poll.
by poll.
Yes, so if you don't follow us on Instagram, we are on Instagram at the.nuanced.naturopaths, and we really like responding to what you want us to talk about. So we looked at our never-ending list of episode ideas and put it out as a poll of like, okay, what do you want to hear about next? And every option got voted for, but this was just the one that got voted for the most. So we thought, let's cover this first. And this episode is the nuance of menopause and hormone replacement therapy in a nutshell.
And the changing attitudes and discussion around menopause, which is really reaching a peak, I think, at the moment, which is really nice.
Yes, yep. It's the dialogue, the conversation is just becoming more nuanced on its own. More people are talking about it. There's louder voices in the menopause and perimenopausal space. There's more information. I think also many women are just kind of sick of not having been heard for however long, and people are like, nah, actually, this needs to be paid attention to.
Yeah. And the stigma that I think partly because it wasn't discussed, and so there was a lot of a misunderstanding around even what menopause is and when it starts and what the symptoms are and what it means. And it's a normal, natural transition in life, like puberty.
It's inevitable.
It's gonna happen.
It's gonna happen, and it's crazy how much time we spend ignoring it or warding it off or being encouraged to like, or not wanting to face it. In a way, it's become its own kind of taboo. And let the record show that the biggest challenge that I will have with this conversation today is kind of encapsulated by what you said, Julie, that like menopause is natural and inevitable. And so what I struggle with is the line between pathologizing menopause as something that needs to be treated, the line between that and offering women going through this transition safe, evidence-based support that can drastically improve their quality of life. And that's where the HRT, so we'll be saying HRT referring to hormone replacement therapy. And I've also seen, is it also being referred to as MHRT for menopausal hormone replacement therapy?
Been a couple of changes in the way that it's referenced, and it's distinguishing it from other forms of hormone replacement therapy.
Yeah.
Sometimes it's referred to as menopausal hormone replacement therapy, and sometimes what was the other one? MHT, I think, was just menopause hormone therapy,
Therapy.
as in it's not replacing. Like, it is
Ah.
normal and natural to have a change in the hormones, in the balance of the hormones, and in the amounts of the hormones in the body.
Mm.
This is what is meant to happen.
Yeah.
So replacing it is
Mm.
not really accurate.
That's a really great, wow, that's a great layer of nuance to cover like straight off the top. I hadn't even, I had seen the new acronyms coming out and I thought, okay, there's got to be some reason behind it. And I just realized that the newer acronyms also help me feel better about it. That it's like, no, no, we're not out to replace what's being lost because that's what's in our DNA to happen. We're
Yeah,
supporting the woman via hormones
yeah.
to improve quality of life.
Mm,
And there's
mm,
more to it. Do we
mm.
start with what is menopause? What is perimenopause? Is that too broad? Is that too
No,
easy for
no,
our
no.
listeners?
No, no, I think that's a really good place to start. So, perimenopause is the time before 1 year after your last menstrual period.
Mhm.
So there is that time period, which is a bit of a grey area. The time before menopause is 2 to 10 years. So can be as early as in your 40s. And then around about 50 to 50, 51 to 53, I think, is the average in Australia, where women will transition into menopause. So they have their last menstrual period, 12 months goes by, 12 months and 1 day, yay, you've graduated and you're in
You are
menopause.
officially menopausal.
You
Or
are officially menopausal, or
okay,
post-menopausal,
menopausal, yeah.
technically.
Because the
Yeah,
menopause is that, I guess, marked as like 12 months after the last period. So
yeah,
anything after that is post.
yeah.
Cool.
But of course, that grey area is the
Mm.
part where a woman will go, and I think pretty much every woman I've spoken to, every woman I treat says, I got to 11 months, I had no periods, and then I had one,
Yeah.
and then I had one in the next month. I don't
Hmm.
know what's going on.
Yeah.
And that's,
Very common.
the last sputtering of the transition,
Yeah.
and then you go into menopause. The
Mm.
the perimenopausal period is when most women experience the most number and the strongest symptoms. And particularly in the last stage, there's kind of 3 stages of perimenopause. And as you transition into that last stage, that's when things really peak. And mostly that's because you get these really high surges of estrogen, and then a drop, and you get this slow kind of drop off of progesterone. So what it can mean is the relationship between those two hormones can be really vast from one day to the next.
Yep.
So that can really cause some really strong symptoms. But it's only a short period of time,
Hmm.
and it gets better.
And on that note, there will be factors that determine an individual's experience of perimenopause, right? Like I mean, I can only imagine there's so much more, well, not only imagine. I do treat women going through severe
Do.
perimenopausal symptoms. Um, but there are so many factors, right, that will make, someone might go through that period a breeze and they don't even notice anything until their periods stop. And then others, it's like, what that, they might even be, I've heard of people in their late 30s being like, what the hell is going on? And it's the start of perimenopause.
Yeah, yeah. And there are a lot of symptoms that I think are very easy to attribute to other health conditions, because it can affect every part of the body in
Mm,
some way or another. It doesn't mean that every woman is going to experience all of those symptoms. I
mm,
think on average, women tend to experience, between 3 and 5 of the collective group of symptoms that they could experience.
yep.
So it might be joint pain, it might be headaches,
Mm,
it might be mood swings, it might be night sweats or insomnia. It can affect any part of the body. And so I think sometimes it's easy to you know not even notice these things as being perimenopausal symptoms.
yeah. And it's a good reminder that your sex hormones that govern your reproductive cycles, the estrogen, progesterone, testosterone, pretty much have a role in every tissue in your body. And so you could be experiencing symptoms and you're like, no, but that's not related to like the pelvic region or my ovaries or any bleeding that I'm having or my vagina. So that can it be, menopause related? And the answer is most likely yes. Because if the hormones are changing, any tissue in your body could be changing. And that including brain tissue. And I feel like that's the biggest one in terms of women noticing that they're thinking differently, they're perceiving things differently. I don't know the statistic, you might have more information than me, but I wouldn't be surprised to learn that a significant amount of women maybe get diagnosed with certain mental health conditions sometime during perimenopause, whether that's anxiety or depression, or other things, just because there's so much changing in the brain.
Mm. Yeah, I don't know what the statistics are either, but because there's another layer to this that we haven't mentioned, and that is the emotional side of things. The
Mm,
the emotional health of a woman who may be at the peak of her career
mm,
with teenage children, which can have, you know, changing dynamics in the relationships with family members. They may also be looking after aging parents. And so the responsibilities and the activity level increases. And then you're also confronted with this apparent aging of the body because, I mean, menopause and aging are two separate things. It just happens to happen at a period of time when you're getting older, but they're still two separate events.
yeah.
uh, and there's a lot of anxiety about beauty and desirability and women being afraid to lose that side of themselves. So that can add to the anxiety and and depression as well sometimes,
Yeah.
along with changing hormone levels, which can make you more susceptible.
Yeah. Yep. It's a lot to navigate.
Mm, it is.
So, it was probably a couple of months ago that I sent you a post on Instagram, and I actually, truth be told, I didn't even know that what we're going to talk about more in depth today was what I had sent you. But I remembered recently, I was like, I sent you a post, and the post was something along the lines of the FDA has removed the black box warning for certain hormonal therapies, and I guess, and I didn't even read into it that much. I just thought this, whatever this is, could be a great topic of conversation for the podcast.
Mm,
And then I guess more conversation around it recently resurfaced and it was put onto your radar as well. And and here we are. So this is what we're going to be diving into is how hormonal therapies have been used insofar as women menopausally seeking help for their symptoms from their doctor or their gynos, I imagine, would be able to prescribe, and how the use of those therapies has changed and how the views on those therapies has changed from like past to now, given that there's just been this significant change in there were warnings on these therapies and now they've just been removed, and there were studies on those therapies where there was risk in implicated, and so lots has changed. So we're going to unpack it a bit, and yeah, the warning is that there is going to be lots of nuance. There's going to be lots of opinions as well as facts, and let's see where we land.
Yeah, yep. And perhaps we'll just reiterate, every woman's experience of menopause is as different as every woman's experience of menstruation, of childbirth.
Yep.
So the treatment, the symptoms, and the outcomes of those things is going to be different for every woman. So
Yep.
just keep that in mind
Yes.
as
yes,
we're
yes, yes.
discussing it.
No one size fits all, no blanketed approaches. This is also anything we say or share in this podcast, you can read the show notes below, is not intended to be medical advice. It's not intended to diagnose, cure, or treat or prevent any disease or symptom. Please consult your healthcare professional.
Absolutely. Also, we don't prescribe pharmaceuticals, and
Yes.
hormone replacement therapy is a pharmaceutical medicine. You will need to speak to your doctor about whether it's appropriate for you.
Yes.
So, hormone replacement therapy was happily being prescribed to many women until a couple of studies came out. One of them was the Women's Health Initiative, which was the largest health research project in the US at its time, which is 2002.
Wow.
And it was a study of 161,000 women, broken into two groups. They were given Premarin, which is the synthetic conjugated equine estrogen, and the other group was given the medroxyprogesterone. Now, both of those are, I don't like using the word synthetic because technically any medicine is synthetic. If it's produced in a laboratory, it's synthetic. But these are not bioidentical hormones. So the equine conjugated estrogen is taken from mare's urine. It's similar to human estrogen, but it's not the same. And the medroxyprogesterone is a progestin. So that is a molecule that is actually more like testosterone than progesterone that a woman makes.
And even then, it's not mimicking any of the sex hormones in our body exactly.
Yeah.
Yeah.
Yeah. So it was a very large study. It was actually stopped 3 years before the end of it because there were incidents of a perceived increased risk of breast cancer, and there was some increase in heart disease and stroke. I should just say, though, that the risk of breast cancer in that study was reported by the media as being a 26% increased risk. But in fact, that's 8 out of every 10,000 women, which is not statistically significant compared to the general population. So it's not an increased risk.
Right.
The other thing is there was they continued on part of that study. It's a bit confusing because the Women's Health Initiative is a group and they performed a couple of studies, but then there was also the Million Women study. And combined, these studies triggered an immediate response from experts who basically withdrew hormone replacement therapy for women in menopause. And the summary of it is that the Women's Health Initiative looked at only one dose and one type of HRT or estrogen only HRT. The dose was more appropriate for younger women, though most of the women in the study were over 60 and even over 70.
Yeah, the
And
range was 50 to 79. Yeah.
yeah, and many of those women being older, that the dosage that they were given was more appropriate for a younger woman, so it was inappropriate for them.
Mm-hmm.
Um, because it was done in America, the profile of the American women in the study was quite different from the Million Women study, and they tended to be older. Because they're older, there was a higher absolute risk of stroke, heart disease, and breast cancer because it increases with age. So that wasn't really factored in. Majority of the women were overweight, and so
Oh.
that has an increased risk of heart disease, certain cancers, and breast cancer. There was a substantial number of dropouts, then that wasn't explained well in the study, and we always like to see why they were dropping out. The methodology has been criticised because it wasn't a randomised control trial where you can actually say intervention X equals this outcome. So that wasn't measured against, say, a placebo.
Oh,
Oh, sorry, this is the Million Women study.
pardon me. So
Right.
these were at around were these around the same time? The Women's Health
Yeah, yeah,
Initiative and the okay, yeah.
yeah. It was around about, I think it was 2005.
Okay.
In the Million Women study, they recruited women who were already having a mammogram, which
Oh.
may mean that they were at higher risk of breast cancer
Mm.
because they're, perhaps going in to investigate a lump. So you got a higher proportion of women predisposed for breast cancer and then giving them the HRT. And follow-up was done by reports from national cancer registries, not by subsequent questionnaires. So changes in HRT use after initial registration were not recorded. So, and the list goes on. I've heard a number of different summaries of how these studies were done. Generally, the methodology was not representative of the women, of the dosage. The results were skewed and then misrepresented. And again, going back to the type of intervention, they were not bioidentical hormones. And we know now that these progestins are proliferative to uterine and breast tissues. And so they can potentially contribute to cancers, whereas the body identical hormones have a more protective effect on them.
Yep.
So the upshot is that this was then not prescribed to women who may well benefit from the use of body identical hormone therapy.
So again, we're finding that issue of misuse and misunderstanding of pharmacological language when the distinction wasn't clear enough between these body identical hormones and these progestins, and it baffles me that there's lots of factors when it comes to this issue, but it baffles me that it is possible that a lot of this comes down to language and like misunderstanding of mechanism of actions of two different therapies that have just been classed under the same kind of therapy, right? Like you could be
Mm.
getting two totally different outcomes putting a woman on progestins versus body identical progesterone. It's just really baffling to me.
Mm. And it's actually not just in these studies, but in subsequent studies using progestins,
Yeah.
they are often referred to as progesterone. So this terminology confusion has continued
Oh,
on.
yeah.
And so it means that unless you're deliberately looking and trying to, tease apart what the studies used
Mm,
and what the outcomes were,
mm.
it's very easy for practitioners to not be clear on what they're prescribing.
Yeah, absolutely. And I remember if anyone is wanting like a bit more specific context or a deeper dive into that, one of our I'm sure it's episode 4 of the podcast, but I'll link it below. We did a little rabbit hole of like progestins versus progesterone because I had found some
Mm.
research that included exactly what Julie just described, where they were just interchanging the two words like it was nothing. And I was recommending wild yam based creams that had body identical progesterone in them. And these products were coming from the US, and these products had that warning label of like, you're using a product that has been shown to increase the risk of uterine cancers. I think it was uterine cancer and breast cancer. So, but when, those findings are based on a entirely different substance. While we're at this point, I do also want to say that when Julie and I were discussing this the other day, one of the first things that came to my head as she was sort of like unpicking these details and these analyses for me was that, like, it's interesting that it's taken menopause for this conversation to come up because the basis of a lot of
Yeah.
birth control pills and treatments for like PCOS or endometriosis are progestin based or include progestins. And
Mm.
it's it's just interesting that, I don't know, has the risk been overstated for menopausal women and then kind of dismissed for this broader category of hormonal contraceptives, that target younger women? And I don't even know what the conclusion is there, but it's just interesting that this is how it's come about. And I want to
Mm.
just make sure that we're not just fully separating like this stuff's for menopausal women and that stuff's for non-menopausal women, on birth control. Like, no, these are interchangeable substances. Now, yes, the dosage may vary, but it's the same thing.
Yeah, absolutely. And, what are the implications for a therapy that has a proliferative effect on the endometrial cells in somebody with endometriosis?
Yeah, yeah. Gosh, I wonder if that's been studied.
I mean, yeah, I'm sure somebody's studying it, but
Yeah.
yeah, no, and I think you're right. The subject does need to be discussed broadly.
Yeah, broadly and in distinct detail. No interchanging hormones with pharmaceuticals.
Yeah, yeah.
Okay.
So they were the flaws, and so now, I think it was November, in the US, it was announced that the black box warning label that was
Mm,
on HRT products
mm,
has now been removed, and they've acknowledged that maybe that was a mistake to have that
mm,
on there,
mm.
and maybe it is actually safe for most women to be using menopausal hormone therapy.
Interesting. Yep.
Interesting. Yeah. We haven't had an announcement here in Australia, as far as I know, but then we have a different regulatory body.
So
Mm.
what and
Mm.
because I know we were talking about the percentage the other day and I forget the exact percentage, but in terms of the impact of the black box warning was put on after these studies came out in the early 2000s, and now they've just been redacted, and it's like, what was the impact of that? Because I think at least in America it did significantly change prescribing behavior by doctors, right? I think I
Oh,
feel like, look, it was a news article, but they quoted like something like 70% reduction in prescription, that women were just
uh,
being dissuaded from using
I
these
think it was,
products.
I've got a note here saying 46% decline in HRT, but I thought it was
Oh,
closer to 70 or 80%.
yeah. So mixed stats
Yeah.
there. So either way, we can acknowledge there was the outcome of these studies and the media reporting on them changed consumer behavior and prescribing behavior by
Mm.
practitioners.
There's real fear around it. My own mother, who had been on HRT since she went into menopause. So she's been on it for quite a long period of time. Her doctors just spontaneously took her off it. And that really distressed her. And she tried seeking other doctors that would prescribe it, and because she was in a regional area, very few doctors, and they were just not happy.
But now this is recently, right?
Well, it's a couple of years ago, yeah, but
Isn't
So
it
she's
interesting that all the hubbub was early 2000s? Maybe let's even say mid 2010s by the time, everything was reported and places caught up. So it's interesting that it had been that long, and it's almost like she was taken off it closer to this redaction coming out. Although further, and like I will do a little bit of devil's advocating, because the question is, like, I'm familiar with your mum's age, but the question is, do we have the long-term studies to show, like, how long is it safe for? At what dosage are these even bioidentical hormone therapies? What dosages are they safe at, and for what period of time? And the word that came up the other day in our conversation was bridging. Where's the bridge, and where's the limit? And okay, gonna get a little bit more exploratory here. We often vouch for patients to come off pharmaceutical products when we can see that the side effects are outweighing the benefits, when it's disturbing their quality of life, or when we believe there has been a sometimes really unfortunately just totally overlooked prescribing, and a little bit negligent at sometimes. And we never tell people to come off their prescribed medications flat out. It's always,
because that's not our job.
that's not our job. It's always, please go back to your prescribing doctor, please see your pharmacist, and at least ask them about it. So we're often in that role. But with these kind of therapies, they are akin to our natural sex hormones. So there's the aspect of natural, but then we've also acknowledged that menopause is a natural transition. So at what point are we really advocating for that prescribing versus advocating for not relying on these exogenous hormones? And at what point are we potentially, and this is probably happening on a more mainstream level compared to the patients that we see, but at what point are we neglecting foundational health practices because you can just get rid of those symptoms with this? If you have vaginal dryness, well, yeah, we'll just give you estrogel. If you're having hot flushes, we'll just, here's the patch, or here's the cream, or you can take it orally. Like, when maybe there's a huge diet thing or a huge metabolic shift going on that could be really well supported with a simple change in the movement regimen of that person,
Yeah.
or by increasing fiber or protein, stress reduction practices. So I'm really trying to hold that line of, I'm a naturopath, and I
Yeah.
want, and I think this is where it's slippery slope. I want women to have the care that they deserve.
Yeah.
I also am a strong advocate for women being really in touch with their innate cycles, menopause being included in that. And
Yeah.
just like I don't want people to avoid their periods, I don't want people to avoid menopause. And
Oh,
I'm trying to toe that line. And I know I don't have an answer, by the way. Like, I'm just sharing my sort of raw progressing opinion, but
yeah. Look, I agree with you entirely. I really do. Because, I mean, the first question you've got to ask is, why do you feel you need support from
yep,
these hormones?
yep,
Because if it's something, I mean, given that once you are in menopause, the symptoms that you experience during perimenopause drop off.
yeah,
So you don't necessarily have those those same really strong symptoms. So it tends to be when you get to that sort of last stage of perimenopause that women are really looking for support.
Yeah.
They might go on MHRT. Do you like how I'm switching the terminology all
Yeah.
around? They might go on hormonal support and then stay on it,
Yeah.
but they will naturally lose many of those symptoms. If
Yeah.
it's something like vaginal dryness and it's causing, problems during sex, or even, some women find that just walking can cause irritation and discomfort. So you can also use some other really good natural treatments for the short period of time that that's an issue.
Yeah. Yep.
Or maybe it need to have some more soy isoflavones. Maybe you need some
Yeah.
flaxseed in your diet or some nice organic soy products in your
Yeah.
diet.
Yeah.
It can be that simple for some women.
It can, and this is again where I'm really hesitant about blanket approaches. And usually when dare I say, pharmaceuticals being prescribed at kind of like set doses with not heaps of tailoring is a little bit of a blanket approach for like so many different women when you think about it. And like you point out that the time that they're probably most desperate to seek answers and to seek help and support is when they can't see it yet because you can't know, but they're actually so close to those symptoms dropping off. And I think, and please, like, let me know if you've had positive experiences with your doctor prescribing these hormone therapies in terms of a conversation being had about duration and a way to measure when it will no longer be necessary or suitable for you
Mm,
to be on those hormone therapies.
mm, mm.
I'm not sure. I haven't sat in a doctor's office as a menopausal woman being prescribed uh, MHT, so I don't have the answer. But I can't imagine that there's a lot of those conversations happening because clinically I just don't see it reflected. I see women being
Mm.
stuck on birth control as well. I see women being stuck on birth control or just sort of like feeling perhaps reliant on these therapies for decades. And
Mm.
yeah.
There's also the prescribing that is done as preventative as well. And
Mm,
sorry, I do that. I mean, I'm not saying that it can't be preventative.
mm,
I'm like you. I always question a medication that is prescribed for the rest of your life. I
yes,
think
yeah,
we always need to ask, is that appropriate?
yeah.
Um,
And
but if
preventative
but
of
if
what?
well, saying the premise is estrogen is supportive of brain tissue. So a lot of women are taking it because it makes them look younger.
And there's my beef. We have a fear of and a lack of acceptance of the natural aging process.
Mm.
That's
Well,
not
because
ingrained in us though. Like this is
no,
a product
because
of society.
yeah, we're being sold this beauty myth that beauty is only youth. It's
Yeah.
only associated with youth. Why can't beauty be being recognized for the wrinkles in your skin that you've gained through wisdom and experience?
Yeah.
Why can't it be a body that has carried children and brought them up and nurtured them?
Yeah.
It's not going to look the same
Yeah.
as a 20-year-old. It's just not.
And it's not bloody meant to.
No,
So this is the
no.
thing, like when we use the word, and obviously we would consider ourselves like in a sense preventative health practitioners. Do you know what I mean? That's a lot of what we do.
Yeah.
But when it comes to if the conversation is about preventing a natural transition out of fear or out of maybe even out of misinformation, maybe there's a lot of misunderstanding about what menopause is, or that it's again the pathologizing
Mm,
of menopause. I think some
Yeah.
people, perhaps potentially even some doctors, believe that it's just it's a pathology that needs treatment.
Yeah. Well, I think if if your practice is built around giving one type of intervention, let's say you've only got pills to give out, then the way that you view your patients is going to be through the lens of, do I give them this pill or this pill?
Mm.
I know that there's more nuance in most doctors' practice, but they do have, there are limited forms of intervention
Yeah,
generally.
yeah. And on that note, if I'm being again real devil's advocate,
Hmm.
and I'm being a really lazy journalist at the moment. I'm going to be doing the thing that news outlets do where they show like the equivalent of when they show like someone's Twitter post as like,
Mhm.
to show the viewers how the public is reacting to this.
Right.
It's going to be a little bit better than that. And my disclosure is that I haven't properly looked into this. I invite you to look into it, or maybe I'll look into it before I write up the show notes if it intrigues you. But this definitely spoke to a part of me. Now, we have a naturopathic forum, and
Mhm.
a conversation came up around MHT. And, a naturopath was pretty much just asking other naturopaths, what do we think about this? Like, have you used it yourself? Like, where do we stand? Like, what's the vibe? And I will say, most of the comments, let's see, there are 79 comments, and most of them are talking about how MHT has impacted them so positively that
Mm.
it's taken away their depression, low energy. They didn't understand what was happening, and then they try MHT, usually in a topical form. I'm seeing a lot of, and they're feeling like themselves again. If not like a brand new woman, they're at least feeling like themselves again. There are a lot of people saying that it helps them maintain a sex life into their 70s and 80s, and that's a really high value for some people. Here's a comment that I came across, and this just got me thinking. So let's see whether this takes us to a discussion or not. That's totally fine.
And this is a
Um,
naturopath, right?
and this is a naturopath, yes. Not so much a comment on the treatment itself, but a comment about the context of why you were seeing the campaigns. The poster mentioned that they were seeing a lot of ads for
Mm.
hormone therapies. It is the first time in 20 years that there are new pharmaceutical HRT medicines being approved, so the marketing machine of pharmaceuticals is in the highlight the need phase, beginning the solve the problem phase, which is very, very common progression in marketing of anything. Messages such as women deserve more, they have been excluded from studies, women don't deserve to suffer the symptoms, a man wouldn't, the Women's Health Initiative has been debunked, are all part of the campaign, which can be found by looking at the US press releases for Femivia or EC508 or others. The Menopause Societies finally have funding to be more vocal, and a quick check of the funding of guidelines/sponsors are the pharmaceutical companies. Are they good or bad? No comment. Are we aware of the origin of the messaging? We should be. And I just think that is important to point out. And now we tell people to come and see us, and we tell people all the ways that we can help them. We make money from that. That is how we make a living. Patients pay us. It's
Yep.
important to remember that the medicines that are being prescribed, and even when we prescribe supplements, people pay for those supplements. Companies are making money from
Mm.
those purchases.
Mm.
It's important to remember that medicines aren't just, and pharmaceuticals more specifically, they're not just like for free because they help people and we live in such a good world and like we just want to help people. It's not charity.
Although that's also true.
Although, yeah, right, yes, for some, yeah. Companies,
Mm. Not
usually
charity.
big conglomerates, are making large amounts of money and have a lot of money to be able to market better. I mean, this is why you don't really
Mm.
see many ads for natural supplements. I mean, you do, but not as much as you see for Telfast or Panadol or, just a normal pharmaceutical.
Yeah. There are some restrictions in the way that you advertise
Yes,
those
yes, yes, yes.
things,
Yeah.
which contributes to it. Yeah.
I was a bit surprised to learn that this person said they were getting a lot of ad campaigns for it, like on social media ads. I thought there would have been some more restrictions there, given that it is a pharmaceutical. But maybe the online world, there's different restrictions than, like we don't. I know in America they have TV ads for prescription only medications, and they just end it with talk to your doctor about starting this today, whereas here we see lots of ads for over the counter stuff, but not really any that like is prescription only.
Well,
And
we're not allowed.
yeah, we're not.
It's
Yeah,
not. It's not permitted in Australia.
yeah. So I'm just finding it interesting because this was an Australian, I believe an Australian naturopath seeing
Yeah.
social media ads for menopause hormone replacement, and maybe that's
Oh,
just maybe they could be advertising like a prompt to book in with a menopausal clinic, perhaps, to like, there are answers for you, there are modern technologies or options, yeah,
or like like the GLP-1 ads that have now been removed by the TGA, the ones that were saying, "Are you worried about your health?" and showing overweight people.
oh really? Ah,
Yeah, they've
interesting.
now been withdrawn. Mm.
Have you online or anywhere have you seen ads for menopause hormone replacement?
No. I
Yeah,
wonder whether this person is
awesome.
somehow seeing overseas advertising.
Yeah, maybe it's very
Yeah.
popular. So yeah, this is in Australia.
Interesting.
Mm.
Interesting.
And the other major concern that came up in this discussion was just kind of what I already mentioned before, just in terms of the safety profiles based on duration of these therapies.
Mm.
I'm not convinced that we have that data.
I don't think we've had the bioidentical hormones long enough to have very much data on it.
Yeah.
I'm sure that they are being studied, but how can we know? They haven't been around that long. Yeah.
Yeah, true.
There there's also the spiritual aspect. This is the woo-woo. And you said it before, that when taking these hormones, she feels more like herself. But you've just gone through a transition where yourself is no longer the same. It's
Great
it's a
point.
neurological rewiring to prepare you for a stage of life as a non-fertile human who
Mm.
has different priorities and different. I mean, even your metabolism changes. You don't have the same requirement for calories that you did previously,
Mm.
because in a communal setting, the the grandmother, this is under the grandmother hypothesis, the grandmother is the knowledge holder who assists the childbearing group, people in the group, to look after the kids, to feed them, to nurture them, to show them the hunting grounds, or particular techniques of finding food. It's a support role. So who you are is different from who you were then. In the same way that you wouldn't describe a prepubescent girl as the same as a postpubescent girl.
Yeah. And we would be
They
concerned if a post-pubescent girl was sort of, or, a woman in her reproductive years, if her goal was to try and feel like her pre-pubescent self, like we,
Some would argue.
some would argue, but, we do,
Some,
you make an excellent point. Like I think it's the nature of humans, but you could argue it's a little bit more juicy and flavorful for the nature of being a female, that we have these really distinct seasons of life, and we have past selves and we have future selves, and there's a lot of shedding in going through these different, there's shedding in every menstrual cycle. So my God, when you have your last menstrual cycle and then enter a whole new era, that is a massive shedding. And I think, I don't know if we have much more to say, but perhaps a semi-conclusionary semi-conclusionary comment, just making up words here. Invitation would be, is it possible, whether are you close to menopause, are you perimenopausal, are you on these hormonal therapies, are you not, are you contemplating them? Is it possible to consider that menopause may have gifts to offer you that you're not yet aware of? I think that's all I want to put out there is it possible? And some people
Mm.
might hear that question, they might go, no, it's not possible. Just let it be a possibility that there is maybe
Yeah.
something that this new phase of life is just so ready and excited to offer you, to show you, but it does require leaning into it and not avoiding and not shaming yourself for getting older and or not shaming yourself for, feeling your lost fertility. Like, that's all looking at it through a lens of your reproductive self when that was biologically your role. If menopausal women weren't needed, it wouldn't be in our DNA. It wouldn't be a capacity in our DNA to experience menopause and then to live this much longer. We would be reproductive
And
until we die,
yeah,
but we're
yeah.
not.
And we live longer than men. And there's an evolutionary reason why we live longer, and it's because we're needed. We're needed for the community. We've got gifts that are so valuable that it's worth extending our lives by taking away the burden of being a reproductive
Yeah.
human.
Yep. Similar to, I learnt from that book that I always mention that Julie purchased on my recommendation and then finished like years before I finished it. But Eve by Kat Bohannon, which I am reading 10 pages a day of on Julie's tip of how to
Excellent.
build a reading habit. I learnt in that populations, back in the day, don't ask me what century, but back in a century that isn't this century or the last century, populations boomed when there was wet nursing and when there were other women
Yes.
around to breastfeed babies who weren't the biological mothers. In that same fashion, I wonder if populations boom and thrive when there are more grandmothers in their menopausal years, healthy and there and available and present to offer help for growing families. I think that is a really important role. And that's just looking at it from like a very biological,
Mm.
protect the species, procreate perspective. But I think menopausal women are crucial to our survival and thriving as a species.
Well, I agree. And that book that you're talking about actually
Goes into
discusses
that.
that
There
and
you go.
and goes into that. So you haven't got to that bit yet. Um, but yes, yes. And it's not just we're not just hypothesizing about humans. There are other species of animals, the finned whales, so orcas and belugas and finned whales. They're called finned whales. Um, some species of chimpanzees, they're Congolese chimps, they have similar social structures to ours. Their grandmothers have similar behaviours. Like they've filmed orcas taking the young orcas and teaching this particular hunting technique, and it's the grandmothers that do that.
That's really special. And I think
Mm.
I just want people to remember that, like, especially if someone is really experiencing more of that emotional, mental health challenge of this transition, like, you are so needed. Like, you are crucial to the
Mm.
human race. Because it can be a time, I feel, when people are really going through identity crisis and crisis of belonging and what their role is now.
Mm.
And I think the answers are within. Your body has the answers. There is an innate wisdom, but there's just a lot of noise and fog that can
Mm.
stop us from accessing that answer as quickly or as clearly as we would like. That's what I
Yeah,
believe.
yeah. pushing up against it because you're not ready
Mm.
is not a very effective way of helping yourself. And I think leaning into it, being gentle with yourself, being curious and open-minded about what the change can mean for you, and having the discussions with your peers, with the women of your age and older, I think is a really, really great way. And that's what we do as women really well, is that we do support each other. I mean, we don't always support each other, but in our friend groups, that's the time when you can lean on those people and
Yeah.
find the good in it.
That's it.
I could keep talking for another hour, but we probably should let people get back to their
next podcast episode or
back to their lives.
So I think, we've said what we wanted to say. Please remember, no one-size-fits-all approaches. If you have questions about your prescribed medications, please go back to your prescribing professional. If you would like our support with holistic, nature-based therapies and tools and techniques and strategies to help make this transition a little bit smoother for you, I mean, I can only encourage you to please book in a discovery call with Julie. This is her bread and butter. This is something that she's experienced. She has the embodied experience of it. And we're here to help, and we can help. And we have so many tools that, unfortunately, by no fault of their own, just isn't taught to a lot of medical professionals. So, we can maybe offer some other puzzle pieces that fit into your beautiful 1,000-piece puzzle that is your life.
Yeah. And can I just suggest that exploring some of these natural, and it's not just supplements, it's lifestyle, it's dietary changes, it's even some mindset changes as well. There's a whole range of things, but it depends on what you're experiencing and what your needs are.
Yep.
Try those first and get your body as functioning as optimally as it can before you turn to the hormonal support. They can certainly be prescribed together, but that is a really effective way to go. And if you're a younger woman who is maybe just entering perimenopause or even in anticipation of it, seeing Corinda is the perfect person to see, because she's working with menstrual cycles and getting women to a really good place, getting people in touch with what the menstrual cycle means at a deeper level. And that kind of preparation can potentially make your journey through perimenopause a smoother one.
And we do know that, if we can optimize your hormone levels and fluctuations while you are still having your menstrual cycles, it can lead to much better outcomes during that perimenopausal window. And I think even doing the deeper menstrual cycle work, maybe some of the more spiritual elements, I think I do believe in my heart of hearts that can make embracing the menopausal transition a lot more easier as well.
Absolutely. Yeah.
We bridge really well together, don't we, Jules?
We do.
I can see someone for a decade
such a great team.
And then they go see you.
Yeah, perfect.
Let us know how you felt about this episode. You can comment on Spotify or you can message us on Instagram. If you're listening, let us know that you're listening. If you like the kind of conversations that we have here at the Nuanced Nats, please consider subscribing or following wherever you are watching or listening. If you are listening to this on a podcast app, our episodes are now also on YouTube if you would like to watch. And let us know what you want us to gab about next time.
Thank you.
Take care. See you guys. Thank you for listening to another episode of the Nuanced Naturopaths. Be sure to ask us any questions you have below, engage with the polls, and we'll catch you in the next one.